Now we'll demonstrate a goniometric measurement for shoulder flexion, and we will be measuring glenohumeral motion. So as the patient moves into end range flexion, we're going to be visualizing and palpating that lateral border of the scapula to see when it starts to move. And when that movement starts to happen, that's where we will measure. That will be the end of glenohumeral motion. So we'll have the patient stay right there. Our axis of motion is the acromion, and our moving arm will stay with the lateral arm, and our stationary arm will stay with the plane of the trunk. So my visual estimate here is about 160 degrees. This would be 180 degrees if you came all the way down to the table. So once again, that spot right there, and we'll align the moving arm with the lateral arm and the stationary arm with the trunk, and we have 150 degrees of shoulder flexion. Now we'll do shoulder abduction. Same idea, where as we come out, we'll be into abduction, we'll be visualizing and palpating that lateral border of the scapula. Right there it starts to move, so my visual estimate is about 150 degrees, and so we will have the patient. Now our axis will be the acromion, moving arm bisecting the arm, and the stationary arm following the plane of the trunk. And so we get all of this aligned, and we have 134 degrees of shoulder of glenohumeral abduction. Next we'll go to the rotation, so we'll have our patient scoot a little bit to the side. We have a towel roll here to keep the humerus parallel with the ground. So for external rotation, we'll come this way. We'll once again be palpating that scapula, and we feel the scapula start to move. That'll be right about there. It looks we're maybe a little bit beyond 90 degrees, so my visual estimate will be 95 degrees. Our axis is the olecranon. Our stationary arm is perpendicular with the ground, and our moving arm is following the plane of the forearm. So I align the goniometer with the axis, stationary arm perpendicular, moving arm with the forearm, and we have 96 degrees of external rotation. Next we'll do internal rotation. So we'll come this way, we'll be visualizing the scapula moving, and that's when we get to the end of our internal rotation. My visual estimate there would be 70 degrees, so we'll have the patient hold that position. Olecranon for the axis, perpendicular to the ground for stationary arm, our moving arm bisecting the forearm, and we have 75 degrees of internal rotation.